Welcome back. If it has joined us, you're watching the news at 10, broadcasting on Channels Television live from Lagos. A reminder of our main stories tonight. National Information Center in Abuja confirms that the military is now in firm control of Bama, the second largest city in Borno State. Oyo governorship race on front burner as various aspirants canvass support ahead of primaries. Federal government clears first consultants Lagos after decontamination exercise. Hospital set to reopen. And bomb blast kills about 20 Islamist rebel chiefs in Syria. You can always read up more on our top stories around our website, channelstv.com, and on youtube.com/channelsweb. If you're on the move, just log on to m.channelstv.com so you can view us live in a mobile device. It will be easier if you just download the Channels TV app for Android, iOS, and Windows phones from their respective stores. We'd like to encourage you to interact with the Channels Eyewitness feature on our Android, iOS, and Windows 8 platforms. So if you have pictures or videos that you'd like to share with us, tap the application on your device, swipe to reveal the Eyewitness menu, then follow the instructions. First Consultants Medical Center can now resume normal operations following clearance by the Nigeria Center for Disease Control and the Lagos State Ministry of Health. Both groups gave the hospital a clean bill of health, having undergone 3 rounds of decontamination processes. This was necessary as this was the hospital where the index case, Patrick Sawyer, was being treated. The Lagos State Commissioner for Health, Dr. J.H.O. Idris, explains further on the reopening.
It will be recalled that it was the first consultant hospital in Obalin that first alerted the government, the Ministry of Health, indeed Nigeria, on Tuesday, July 22nd, 2014, of the possible presence of the Ebola virus disease on our shores. The critical success recorded so far in the management of this outbreak is attributable to their patriotic and professional call to duty. First Consultant Hospital in Obalene has been successfully decontaminated in line with the W.H.O. international health regulations and has since been issued a certificate by the Nigerian Center for Disease Control and the Ministry of Health to reopen for business. This clean bill of health has been long in coming, and I hereby encourage patrons of this facility to support this facility at this point in time by continuing to utilize it for their medical and allied needs. The facility, according to our records, remains a flagship medical center. It is very essential to know that they've been given a clean bill of health. They've been decontaminated many times, and the Nigerian Center for Disease Control has certified them ready for business. On that basis, we have issued them a letter that they could reopen for business.
Commissioner of Health here in Lagos, Dr. J.H.O. Idris, and as the nation gradually moves on to a state of normalcy, there are new concerns to grapple with to make the healing complete. In Lagos still, the State Health Commissioner, Dr. J.H.O. Idris, turns his attention to problems of stigmatization, and the Minister of Health, Professor Pt.2, is eager to see neighboring countries free of the Ebola virus disease. Our correspondent, Mary Alala Yusuf, reports.
The Lagos State Commissioner for Health went on to note that people discharged from the Ebola Treatment Center are facing different degrees of social problems. These include stigmatization, eviction from living quarters, being asked to stay away from work, and termination of appointments. The Commissioner urges an end to all discrimination and goes on to spell out the consequences of such behavior.
People feel stigmatized and they may not want to come out because of that. And if they come up with symptoms, they may not come out. They are not only jeopardizing their own lives, they are also jeopardizing the lives of the other family members or other people they come in contact with. I want to emphasize again that the Minister of Justice will take the matter up. Anybody who feels stigmatized can petition the Minister of Justice, and they will take that matter up.
He also informs those present that more success has been achieved in the fight against the disease.
Since we started in Lagos, we've had 366 contacts. Out of those 366 contacts, only 5%, as at last night, 19 of them are yet to conclude their 21-day surveillance or follow-up.
Over in Ondo State is a sensitization session for healthcare professionals, media personnel, and others. The resource person, a consultant epidemiologist based in the UK, Dr. Femi Oshin, stresses the need for a strategic response plan to the Ebola virus disease. He expects that those here will train healthcare coordinators at the local government level.
They are familiar with what they are required to do. They know what other agencies are doing, so that even though the whole team may not be sitting in the same room, they know that everybody is doing their own bit and everything is going according to a plan. The strategic response plan is not only about just activities, it requires resources to deliver those activities, and the state government has made those resources available, a series of training, equipment, consumables, various things that are going on in order for that plan to achieve its goal.
And up north from there in Abuja, the Minister of Health, Professor Pt.2, is telling Nigerians that as long as everybody plays their part, there is no cause for alarm. He, however, cautions that the country cannot rest on its oars as long as there is any case of the Ebola virus disease anywhere in the world.
As long as there's even one case, even if there's no single case as today in Nigeria, but you have one single case anywhere in the world, Nigeria will still be at risk because of travel. We're not stopping people from traveling, and Nigerians love to travel. So they could go elsewhere and still get infected. Other people, like in what happened to Nigeria, could also visit us, and we have the problem. So we must remain vigilant.
He goes on to say that the Ministry of Health and Education are working together to make sure that all students and pupils returning from other countries for their academic pursuits are screened for the Ebola virus disease at all points of entry. With the picture of Ebola outbreak in Nigeria looking less ominous by the day, more attention is shifting to the borders and beyond to make sure no case is imported. Mary Alale Yusuf, Channels Television News.
More health news. Has been an outbreak of gastroenteritis in Sokoto State, northwest Nigeria. Health officials tell Channels Television that 4 villages were affected in Wamako local government area of the state. The state epidemiologist, Ango Umar, says 40 patients have been hospitalized within days of the outbreak of the disease. Gastroenteritis causes inflammation of the stomach and intestines, leading to vomiting and diarrhea.
This is Kasarawa village on the outskirts of Sokoto city, northwest Nigeria. Like several other villages in the state, waterborne diseases are recurrent experiences during wet seasons. Out of the over 60 patients affected by the recent outbreak of gastroenteritis, 24 were on admission in this health facility. About 40 more were outpatients seeking daily treatment. When Channels Television visited the medical facility, there were no patients in the treatment wards. Only outpatients were seen waiting for treatment.
Ina jin zazzabi ko yaushe ƙahahuna na ciwo ran juma'a na yi gudawa aji 4 sai na zo inda mijin yau ya mai allura ya ban magani to tun nan ban kuma tsugunne ba shekarun jiya na taho ana manci ladina ko da mun ka taho asibiti ana tana rai sai mun ka koma sai ya mun ka dawo.
The government has no records of deaths in the villages. Meanwhile, health officials say the situation has been managed with no fatalities from patients admitted in their hospitals.
Initially, during the outbreaks, many patients were coming. In fact, I cannot specifically ascertain the number, but we know that as many as 20 to 25 patients were on admission here. And within a short period of time, we tried to deploy health workers who came here to assist the other health workers that are already working here to attend to the patients. And within a period of 2 to 3 days, some of the patients were discharged. We have not recorded any number of deaths in the health facility. We have been hearing that some people died at home, but we cannot ascertain what actually is the cause of the death.
This is not the first time the state is experiencing outbreaks of such waterborne diseases. Hence, the government says there was no need to panic.
I discussed with my permanent secretary, and the permanent secretary wrote to the water board, state water board, inviting the staff to go around together with us so that we can disinfect all the wells in the other local government, not only this place, but in all other local governments, just in anticipation that this problem will come off. It has really helped. If you can see even example this place, it was because of that intervention. That's why the cases now are no more coming.
The situation could have taken a different dimension. That is why Sokoto State government intervened by prohibition of drugs and the development of personnel. And presently, there is no a single person in any of the ward or facility in Sokoto State as a patient with this issue of vomiting and diarrhea.
Medical experts have attributed outbreaks of most waterborne diseases to poor hygiene and lack of access to clean water. Unless proper attention is given to hygiene, it may be difficult to prevent the outbreak of diseases like this in rural communities.
We turn to politics now. Oyo State in the southwest may be an APC-controlled state, but the PDP appears not to give the ruling party an easy ride at the coming governorship election. The top contenders of the PDP are already going around town to canvass support ahead of the party's primaries, which determine who will fly the party's flag. In this report, our political correspondent, Shewa Kimaloye, spotlights the early activities of the three main aspirants of the PDP.
Ibadan, one of Africa's largest and most popular city, agog again. Political posters now dot every nook and cranny of the capital of Oyo State. This crowd has turned out to cheer the former governor, Adebayo Alao-Akala. His supporters marched through the streets to usher him into the arena where he planned to make a declaration to run for the office he left less than 4 years ago. In a dramatic fashion, Mr. Alao-Akala gets to the ground in a show of sober reflection, and when he gets up to his feet, he makes promises on delivering people-oriented programs if given another chance.
These past 3 years, I've had time to reflect on our performances, as I believe many of you have. Did we satisfy the yearning of the masses?
As Alao-Akala makes his intentions public on the street, another contender in the PDP, Mr. Seyi Makinde, has begun consultations with some party leaders and supporters. He is optimistic about his chances of getting the party's ticket.
For the states, they're looking for a change, which is what I think we represent. We want a station where your state can be the food basket, of the country.
In a battle ring for the Oyo State governorship ticket, this man, a former Senate leader, Teslim Folarin, is also a contender. He is meeting with traditional leaders and the people from his constituency. As he has his eyes on the ticket, he also has his heart to what he thinks he could do for the people of Oyo State.
And for us, you get education right, because that is what underpins everything you're trying to achieve. And of course, you invest in the health of the citizens of the state. And, the sky's the limit.
The next couple of months will indeed be very interesting in Oyo State as party delegates decide on who gets the ticket. The ultimate decision on who becomes governor lies in the people's votes. Sheung Okimale, Channels Television News.
When the news at 10 returns, Finance Minister Dr. Ngozi Okonjo-Iweala asks accountants to ensure financial integrity in their daily conduct. That will be business news. Please join us again.